In 2014, a 79-year-old woman, a vibrant lady with a history of hypertension but otherwise healthy, suddenly found herself in the ER. After a routine checkup by the resident doctor, she was sent home with a prescription to treat what appeared to be a simple UTI. She left with a strong antibiotic and some NSAIDs for the discomfort. But what no one realized at the time was that a tragic mistake had just been made. The hospital staff failed to check her new prescriptions for interactions with her existing medications. Just 1 week later, her health deteriorated drastically. She lost her appetite, felt unusually weak, and her face began to swell, a clear sign that something was very wrong. Her kidneys, which had been functioning perfectly before, had completely shut down. By the time she was rushed back to the hospital, it was too late. She passed away less than 2 weeks after that first ER visit. So now the question is, how many CKD patients today are still falling victim to the same preventable error that cost this woman her life? Hi, Catherine here. I'm a doctor of natural medicine and I've dedicated my whole career to working with CKD patients. Over the years, I've identified 5 common medical errors that impact kidney disease patients more than anything else, and they happen far more often than they should. And here's what I've learned. In some countries, the healthcare system is, quite frankly, broken. Let me show you why. The case study we have just learned about happened in 2014, but the horrifying reality is that this is not ancient history. I've consulted patients who have been prescribed the exact same dangerous combination of medications that costed that woman her life in 2024. Think about that. In nearly a decade, we've made little progress in preventing these life-threatening mistakes. And that's just one example of the errors I see regularly. But I know what you're thinking. Could you be taking the same combination of medications? Should you be worried? Let's not wait another second to find out. Here are the 3 medications that should never be prescribed together to a CKD patient and why. So here's the reason that 79-year-old woman who wasn't even a CKD patient before this lost her kidney function and tragically her life. She was prescribed a combination of these 3 medications: an ACE inhibitor or an ARB, a diuretic, and NSAID. Now here's the truly terrifying part. ACE inhibitors and ARBs are the first-line treatment for kidney disease. They are prescribed to nearly 80 to 90% of CKD patients. Now keep this in mind, please. If you're taking an ACE inhibitor or an ARB, that's perfectly normal. And if you're also taking a diuretic, that's common too. The combination of those two is fine, so don't panic. But here's where the red flags start flying. If you're also taking an NSAID, that's when things can spiral into danger. And here's the problem. These aren't obscure medications we're talking about. NSAIDs include common over-the-counter drugs like aspirin, ibuprofen, Advil, Motrin, naproxen, Aleve, the kind of stuff you can grab at any grocery store without a second thought. The problem, even when taken alone, NSAIDs are notorious for being bad news for the kidneys, especially for anyone with CKD. Why? NSAIDs reduce the production of crucial chemicals that keep blood flowing to the kidneys. Without these chemicals, the blood vessels in your kidneys constrict, cutting off vital blood flow and reducing kidney function. Now imagine adding an ACE inhibitor or an ARB and a diuretic to the mix. This combination, often called the triple whammy, doesn't just drain your kidneys, it can shut them down completely. The result, a catastrophic loss of kidney function that can quite literally cost you your life. Question: how common is this triple whammy? So let me ask you, on a scale from 1 to 10, how shocked would you be to know that some CKD patients are still being prescribed low-dose aspirin today, even when they're already taking an ACE inhibitor and a diuretic? Yes, even now. And while low-dose aspirin for heart protection isn't quite the same as taking it for pain relief, it can still be dangerous when the other two medications are in the picture. There are safer alternatives for CKD patients, but shockingly, some are even told to take NSAIDs sporadically for pain relief. Please don't do that. In short, if you're living with CKD, make it a rule. Never take NSAIDs, especially if you're also on an ACE inhibitor or ARB and a diuretic. Your kidneys and your life depend on it. But here's the thing, guys, this isn't even the most common medical error I've encountered. Coming in at number 4 on my worst of the year list is something far more widespread: forgetting about renal dosing adjustment. Now, this is a big issue and it's way more common than prescribing NSAIDs. So, what is renal dosing adjustment? Renal dosing adjustment refers to the practice of adjusting the dosage of certain medications based on a patient's kidney function. Here's why it matters. Many medications are cleared by the kidneys. That means if your kidneys aren't working as they should, these drugs can build up in your system and cause serious harm. This is why, if you have reduced kidney function, you cannot take the same doses for many medications as the general population. Doctors should always check a patient's GFR or glomerular filtration rate and adjust medication doses accordingly. Now, to be fair, most doctors are aware of this and they prescribe the right doses to kidney patients. But here's the real problem. Kidney function declines over time. You see where I'm getting at? Yeah, this is a big deal. Think about it. The dose of a medication you needed when you were in stage 3 CKD might no longer be safe in your kidney function has since dropped to stage 4 or 5. This means a medication that was perfectly safe when it was prescribed might be dangerous now. And now the question is, to which medications should we pay close attention? There are many medications that need renal dosing adjustments, but let's talk about the ones I see causing issues most often in my patients. Most common issue is probably Farxiga or dapagliflozin. Lots of patients take this one, and don't get me wrong, Farxiga is fantastic for protecting the kidneys and reducing proteinuria, as long as your GFR is above 25. However, if your GFR drops below 25, this medication may become a huge burden for your kidneys. It may actually become more of an issue than a help. Now, I'm not saying you should stop this medication immediately if your GFR is below 25, but this is something that you should actually discuss with your doctor. Another problematic medication is metformin. Metformin is generally safe at full doses as long as your GFR is above 45. But if your GFR drops below 45, the dose needs to be reduced. And here's the problem. If your GFR falls below 30, metformin should be stopped entirely. Why? Because it can accumulate in your body and lead to lactic acidosis, a dangerous condition that could land you in the ER. Not nice, not worth it. Now, Farxiga and metformin are just two examples. There are many other medications that need careful dose adjustments as kidney function declines. These include allopurinol for gout, statins, certain anticoagulants, and more. If you're taking any of these medications or if you're wondering about something I didn't mention, don't adjust the dose on your own. Talk to your doctor and make sure your prescriptions are tailored to your current kidney function. Because when it comes to your kidneys, taking unnecessary risks is never the right choices. Now, let's talk about an even bigger danger for CKD patients. Number 3 on my list is kidney toxic supplements. Here's the problem. While medications are heavily regulated, supplements are not. That means your doctor may not know whether the supplements you're taking are safe, whether the dose needs to be adjusted, or whether you should avoid them entirely. And let's be honest, this is probably more in my field of expertise than your doctors or even your nephrologists. So are doctors right in telling CKD patients to completely avoid any supplement whatsoever? Well, of course not. There are certain supplements that can be incredibly helpful and some even essential for CKD patients. But I want to leave what these must-have supplements are for another video. In fact, a more pressing issue is making sure that you are not taking supplements that are dangerous for you. And yes, it happened to me to have to tell a patient to stop taking one or more supplements. Right now, the more urgent question is, are you taking any supplements that are dangerous for your kidneys? Okay guys, just like with medications, I won't bombard you with a long, boring list of supplements. It will take hours and nobody's got the time. Instead, I'll focus on the supplements I actually see CKD patients using. Yes, this is what you should worry about. So very first thing I want to mention is cod liver oil. Cod liver oil is often marketed as an alternative to fish oil or omega-3 supplements. It's touted for its omega-3 content and supposed bone health benefits due to vitamin D. But here's the catch. Cod liver oil is loaded with vitamin A, and for people with CKD, vitamin A is a ticking time bomb. Since your kidneys can't clear vitamin A properly, it can accumulate in your body, leading to serious toxicity. This can result in liver damage and, most critically, rapid kidney damage. And here is the shocking part. When it comes to vitamin A, even the doses found in standard supplements can be dangerous for CKD patients. So the rule is simple. Never take cod liver oil. Instead, stick to omega-3 supplements. And the same is also true for other supplements that contain vitamin A, such as most multivitamins. Most multivitamins on the market contain vitamin A, which makes them unsafe for CKD patients. I'm talking about the popular brands that contain vitamin A, Martipans or Supradin if you're in Europe. If you have CKD, these are not safe options. And now let's talk about those so-called kidney cleanse supplements you see on Amazon. You know, the bottles with a long list of herbal ingredients that promise to detox your kidneys. These are what I like to call the Russian roulette of supplements. Out of 15 ingredients, 14 might be harmless but useless. But that one wrong ingredient, it could mess with your serum levels or interact with your medications, putting your kidneys and your life at risk. Here's an example. Some of these kidney cleansers might contain cinnamon cassia, which is known to be liver toxic. Combine that with a mystery mix of other herbs and you're rolling the dice on your health. So yeah, if you are wondering why your doctor is so scared of supplements, this is why. Now, something else you should be careful with is high-dose magnesium supplements in CKD stage 4 and 5. I know that this may come as a surprise since magnesium is usually super healthy for most people. But in CKD stage 4 and 5, it's a different story. Since magnesium is cleared by the kidneys, there's a risk, albeit small, of it accumulating in your body as your kidney function declines. Here's what I recommend. If you are in stage 4 or 5, ask your doctor for lab tests to check your magnesium levels before taking supplements. But here's the golden rule. Avoid cod liver oil, multivitamins with vitamin A, generic kidney cleansers, and be careful with high-dose magnesium supplements unless specifically recommended and monitored by a healthcare professional. Now let's shift back to medications because there is another critical issue I see with my patients. Another medication that you could be actually taking right now. Number 2, proton pump inhibitors or PPIs. So this is another class of medications that's dangerous for the kidneys and that you should know about. Why, you ask? Because your doctor might not have flagged it for you yet. So proton pump inhibitors or PPIs in short. These are commonly prescribed to treat acid reflux and heartburn. You've probably heard of some of them: Prilosec, pantoprazole, omeprazole, esomeprazole, Acifex, Nexium, and others. But here's the problem: PPIs can be really bad news for people with CKD. Question: what do PPIs do to your kidneys? These medications can trigger an immune response in the kidneys, even in people who don't have an autoimmune condition. This immune response leads to inflammation of the kidneys, interstitium, and tubules, causing a condition known as acute interstitial nephritis. In the short term, it's a kidney crisis waiting to happen. In the long term, faster progression of kidney disease. So sure, your heartburn might be gone, but now your kidneys are on fire. And now you may ask, are there alternatives? Yeah, the worst part is being prescribed PPIs is incredibly common, even when there are safer alternatives. If you need medication for GERD or acid reflux, ask your doctor about switching to H2 blockers like famotidine, brand name Pepcid. These are much gentler on the kidneys and can still help with your symptoms. But why am I mentioning this? The reason I'm highlighting PPIs today is that I've seen more than one patient in the past few months still taking these medications. Yeah, more than one in the last few months. And no, I don't see 1,000 patients a day like most PCPs do. Now, each and every time I spot one of these dangerous medications, I know I'm gonna have a frustrating conversation with a patient, because not only do I have to deliver the bad news that your doctor might have overlooked this, but it also creates a trust issue. Think about it. Patients start to either stop trusting their doctor or they stop trusting me. And honestly, I'm not sure which is worse. And now, we have right at number one, the worst and most dangerous risk the healthcare system is forcing kidney disease patients to face. Number one is not having a doctor you can trust. Or worse, not having a doctor at all. Okay guys, time to talk about the scariest reality for CKD patients. Look, it's bad enough when I discovered that a patient is taking the wrong medication or a supplement that could seriously harm their kidneys. But what's even worse? When I see a patient who isn't taking any medication at all. No losartan, no amlodipine, no insulin, no atorvastatin, nothing. Now, this is actually more common than one could imagine, and I see this especially in patients from the United States. Yeah, I'm not kidding. So here's the shocking part. This isn't happening in underprivileged, underserved parts of the world. No, I see this most often in patients from the United States. Wait, the United States? You probably thought I was talking about a poor country, right? But no, I've worked with patients from all over the world, and I have not seen people from poor countries going about their lives with stage 4 kidney disease and no medications. I haven't seen patients from those countries asking me for the correct dosage of an ACE inhibitor because their doctor didn't care enough to provide it. But patients from the US, why is it so hard to find a decent doctor in the US? Now, of course, this is not an issue every single patient from the US is having. I have also seen plenty of patients with excellent doctors as well. And I know this is a complicated issue far beyond the scope of this video, but let's be real. There is something deeply wrong with the healthcare system built to prioritize profit above all else. In a system where profit comes first and patient care is a distant second, we get this kind of dysfunction. And yes, I know this is going to anger some people. I'm not saying other countries have perfect healthcare systems. They don't. But let's be honest, when people with health emergencies are forced to take Ubers because they can't afford the ambulance ride, is that really a system that works? Now guys, I want to hear from you. What's been your experience with the healthcare system where you live? Leave a comment below and let me know what you think. Together, we can shine a light on these issues and create awareness. And this is all for today. Thank you for watching. God bless you all. Arrivederci.